Hey, Dr. Shalini, I'm with a patient here. He's complaining of neck pain with numbness and tingling in his arm. He's a boxer slash MMA fighter, right?
Yeah.
So why don't you tell the camera your story, and then we'll do our intake and see what we need to do.
Well, I've been a wrestler for like 10 years, well, actually my whole life, and I've had like neck problems, but it's never been like this before. Like, I was doing Muay Thai sparring about a week ago, and I got hit in the head a few times, and my neck started bothering me, and then my upper back started bothering me, and I started getting shooting pains that go all the way through my arm. Like, I could feel it in my elbow, and then sometimes my pinky will go numb. So I think it's stemming from my neck, and it's like a nerve pain. And it hurts when I'm just sitting here. Like, even when I'm just like sitting here right now, I can feel it.
But moving, you're okay moving.
Like, once I get warmed up, and if I do like a training session, once I'm warmed up, I won't really feel it. But afterwards, it will be a lot worse.
Okay, let's take your hat off. So, as a chiropractor, obviously we're going to be looking at the neck.
Yeah.
And if you want the camera to swing around, I'll be using this thermo device just to measure the heat in the area that's put off by autonomic nervous system. So bring your head down. Usually you'll see this instrument a lot in doctors that practice the Gonstead technique. I'm just getting a baseline because I don't have any other diagnostics right now. If you have these, what I'm thinking about is a herniated or a bulging disc that's causing pressure on one of the nerves that go down your arm. So I'm not really getting much of a reading here. Right there. So C7, C8. Okay. So what we're going to do is going to work our way down here. So what I'd probably recommend, is it really sensitive right there? Or not really?
No, it's weird. It's not sensitive. It's just I get shooting pains down my arm.
So look straight ahead. What I'm going to do is I'm going to do an orthopedic test. When I press down, does this make it worse? Or
yeah, I feel that like behind my scapula.
Okay. How about when I go this way? Does
that
make it worse?
That's a lot worse.
So you're stretching the brachial plexus on there.
Yeah.
Okay, bring your arms back up. Just hold them like this. Don't let me push down. Do that again.
Mm-hmm.
Okay, put them down. Okay, good. I see you got some cupping there too, so we're getting a little bit of work done everywhere. Let me do a bicep. So don't let me pull out. Okay, good. Don't let me pull out. Okay, good. Don't let me push in. I see you nice and strong now.
No, the strength is there. It's just like a nerve pain.
I'm going to lift your head straight up.
Okay.
Now when I lift the head straight up, does that take pressure off that arm? Do you feel a little bit more, feel better?
Yeah, it kind of feels good, but
Kind of feels
I can
good?
still feel it, yeah.
All right. Then when I take it back, does it come back?
I don't know.
Okay, now we'll do a little compression. When I press down, is that making it worse?
Yeah, that definitely makes it worse.
So, what I'm thinking, without an MRI, you're probably irritated a nerve, bulged a disc. What I would recommend is go get an MRI.
Okay.
What we're going to do today is I'm going to adjust you, and I'm going to put you in some, what's called spinal decompression to unload that disc level. That'll take some pressure off. So let's start with the adjustment because I know you really need it. So let's go face down. So what I'm going to do today, right now, is I'm going to use the Cox cervical flexion extraction table. This is my preferred method when people are dealing with bulging discs or herniated discs. Right here, I'm doing what's called long axis Y traction or decompression. You'll see a lot of chiropractors doing, let's say, the Y strap adjustment or the ring dinger adjustment. This is a lot more comfortable. It's a lot safer in my opinion, and we can actually control the pull. So I'm right here, long axis. You should feel a little pressure coming off that. Good, so right there. So lifting up and pushing forward, taking pressure off. Good. Anyone that has a compressed disc or an irritated nerve, this is like the most comfortable thing in the world, this table. So what we'll do after this is we'll get you on the DRX 9000C cervical decompression table. You'll be on there for about 25 minutes. And I'll do this, and I'll also follow up with a traditional chiropractic adjustment to really get things back in alignment. We'll get you on the DRX 9000 for 20 minutes, and then what I'd like to do, I know you have some time, get you on some laser therapy. That laser is going to help get some of that inflammation to go down, get rid of some of that pain. So right in here, unlock the table, take a nice deep breath in, relax your head, neck and shoulder, down. There we go. Clunk. Easy, right? Breathe in. How much air? All the way out, down. Good. Back in the middle. Breathe in, last one. And all the way out, down. Good. Flip over, lay on your back. Take a nice deep breath in. And all the way out. Drop this. Good. Perfect. Sit up straight. We're going to get you on spinal decompression now. So, hop up over here. Okay, so what's going to happen is your head is going to be nestled right in here. So lay flat on your back. Switch up a little bit more.
What do I do with my arms? Outside?
Yeah, outside. Okay, right there. Okay, and what we're going to do is we're going to get you set up, and I'm going to pull right at C7. So what's unique about this table is we can dial into the specific disc level that's affected.
Yeah.
Almost always everyone that comes in has an MRI.
Yeah.
So we could go to, so most people are C5, C6, but I have a feeling that you're a lot lower because I know your body and I know your spine.
Yeah.
So I'm going to set it to C7, which is, you know, affecting the C8 nerve, which I think is a nerve that is affected. Bend your knees. Okay. Pick them up, slide it down. Good. All right. So what's going to happen is shimmy down towards your feet a little bit. There you go. Good. Clunk. All right. So you're right there, and then what we can see here in the machine is we're using right there, using about 28 pounds, and click OK. And let's get you going again. This is the DRX 9000C, non-surgical spinal decompression. We're doing it to affect his disc at the C7 disc level, which I feel is impacting his C8 nerve root, which does go into the pinky, which will cause numbness and tingling. Most people have it C5, C6 that affects these fingers, but most people come in with their MRIs and have had previous treatments, and this is a protocol that is usually done over about 20 visits, and this will get rid of most of their pain, inflammation, and get them moving again. So what we're doing here now is we're just watching the table slowly build up weight, and it'll build, 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 and relax. Build, 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 and relax. He'll be here for 20 minutes. We'll come back and check on him and do the next part of his treatment. So you just rest and relax. So what we're doing here is we're doing the latest and greatest cold laser therapy made by Arconia. This is the FX635. We're the only one in Manhattan that has this machine. It's pretty awesome. It has 3 heads. And what we're going to do is we're going to program it to use right here at that area, and then you know what, we're just going to pull this down just a little bit. Just like that. And we're going to use a protocol they've been using for people that have herniated discs, and we're just going to start. So what we could do is it's moving, hitting his trap, hitting his neck, hitting all the key points, and it's a painless procedure. There's no heat, that's why it's called cold laser therapy. And what it's doing, it's stimulating the mitochondria, which is an energy powerhouse cell of the body, decreasing inflammation, decreasing pain, accelerating healing tissue time. We did a press release about this a week ago, that this is added to my cervical, spinal, and lumbar decompression protocol. This is an 8-session protocol. So we're doing this 2 times a week for 8 visits. FDA has a clearance to people that have chronic lower back pain. 76% of the time they're getting better. So when you combine this with chiropractic care, spinal decompression, and cold laser therapy, we got a pretty killer treatment protocol in getting patients out of their pain, back to training, fighting, whatever they'd love to do. See you in the next video.